Good morning. Any parents out there? Quite a few of you, quite a few of you. Well, parenthood is certainly one of the most joyful, profound experiences in our lives. But it really requires a village, does it not, to support our moms and our children, and not just from family and friends, but also from healthcare professionals, doctors, midwives, doulas, nurses, and other healthcare professionals who are so essential to this process. And I would add to that as well, mental health professionals. And back in January, I said I was going to fight for changes in our laws and our policies to allow more moms and babies to literally just stay alive and to thrive. And I'm really proud today to say we got it done. And I want to thank everyone who is involved in this process, my partners in the state legislature, Majority Leader Andre Stewart-Cousins, Speaker Kyle Hasty, our local assembly member here, Bernice Bichat Hermelin. I want to thank also for her leadership there, but also in this, all she does here. Locally, we have our borough president. I want to thank him as well, Antonio Vernosi, to be hearing from him. Helena Grant, the president of New York Midwives, we're hearing from him. Wendy Wilcox, the chief women's health officer of NYS Health Hospitals. Assembly members Bobby Carroll is here. Thank you very much. Joanne Simon. Council members Mercedes Narcisse is here. Joined us. Thank you, Mercedes. Jennifer Gutierrez is here. Jennifer. Also, we are blessed and fortunate to have a great friend of mine here, former Congresswoman, but now the chair of Now New York State, Carolyn Maloney. Carolyn. And Caroline Sanchez, thank you for hosting us here at the Dodge YMCA, so thank you. You know, it's important that leaders call out problems when they see them, not try to mask them and hope they'll go away just because others before have not taken them on. And the sad truth is that our country is staring down a crisis when it comes to maternal and infant health. Before, during, and after childbirth, women in the United States are dying at a higher rate from these pregnancy-related causes than any other wealthy, developed nation on the planet. Process that for 1 minute. We pride ourselves on so many things, but for us to have a higher rate of death for women who simply want to have a child and their babies, this strikes at the core of who we are. If we can't protect society's most vulnerable, newborn babies and their moms who are in a tough situation, then what are we here for? What is our purpose? In 2022, some of the latest numbers we have, we started to see a trend that is so disturbing. America's infant mortality rate rose for the first time in 2 decades. It started going up. What happened? We're getting more sophisticated, more health care available. We have health care available to more people. What is going on when that phenomenon is taking hold in our nation? We now have double the rate of our peer countries in terms of both infant and maternal mortality. And it's no secret that black and brown families are disproportionately affected. Black babies are more than 2.5 times more likely to die than white babies. Black women are 3 to 4 times more likely to die in childbirth than white women. Does anybody think that's acceptable? No. We have to stand up and fight for these people, fight for them, stand up and use every tool at our disposal to change that outcome before it's too late, before we lose any more people. Reversing these trends in our state is one of our top priorities. It has to be, because if not us, then who? Since 2010, we've jumped from 46 in the nation to 15. That's better. But we're New York. We shouldn't be 15 at anything. We should be number 1 in protecting our moms and our babies. Should we not? We should be number 1. So that's why I came to Brooklyn back in January. We were laying out the planks of our State of the State address. I said, we're going to address this head on. We will not shirk away. We will not bury our heads in the sand. And over the last few months, I've implemented executive actions to make significant progress to start. First of all, by eliminating co-pays and out-of-pocket expenses for pregnancy-related care for 1.3 million New Yorkers. So making it less expensive at a time when affordability is such a crisis as well for many of our families. We also have new oversight measures to identify physicians who are overutilizing sometimes unnecessary procedures during labor and delivery. Need I say C-sections? I mean, for many, that's just a convenience. But is it really what's best for the mom and the baby? Is that the paramount calculation here? It hasn't been. It will be now. But that's just the beginning. In our budget negotiations, I fought for a 6-point plan to tackle these issues head on right here in New York. Let me just take a couple minutes to tell you about it. Point 1, I'm really proud of this one. New York will be the first state in the nation to offer fully paid leave for prenatal care. That means we already have the strongest paid family leave program in the country. That's great. And it's making a difference for thousands of families. But that kicks in after the baby's born. Women need help during pregnancy as well. I was fortunate. I was an expectant mom working for Senator Daniel Patrick Moynihan on Capitol Hill. The hours were long and grueling. Sometimes we had to pull all-nighters during session. I remember being this big, trying to waddle to my car in the parking lot at 2 in the morning. Probably not the safest thing that I've ever done, but that was our job. But I never had to miss an appointment because I couldn't afford to go. I made all those appointments. I was there. Sonograms, blood tests, everything you need to make sure that you're giving your baby the best start in life. But what about the moms working minimum wage jobs, hourly? They take off, that's less money for themselves or even other children at home. Regular prenatal care improves the odds of a healthy pregnancy. It's not complicated. Women are in an impossible position sometimes, choosing between bringing home that paycheck to the size it's supposed to be and taking care of their own health and the health of their baby. I say those days are over in the state of New York. We're putting our moms first and making sure that they have these prenatal appointments without fear of losing income. We got it done here in the state of New York. And we're raising the bar for the rest of the nation. I want every mom in this country to have the best chances of positive, healthy outcome for themselves and their babies. So I hope every other state in this nation follows our lead. Also, moms sometimes have to choose about getting paid and taking time off to pump breast milk. This should be more normalized than it is. There should be no restriction. If you've made the decision to breastfeed your baby, there should be no obstacles. That's why Part 2 of our plan requires employers to offer paid time. You don't deduct that time from a woman who needs to do that during work hours. She can't plan this to happen during off working hours. It doesn't work that way. Workplaces need to support pumping so everyone can benefit. It lowers the risk of illness for babies. That's important. Reduces the stress on new moms. And also, this is one of your employees. My advice to employers is help the mom get through this time. Invest in this individual. Give her the support she needs now. That'll help you keep your employees coming back, because eventually the babies get older. Things change. I'm proof of this. I have a grandbaby now. It's fun to watch them have to take care of the baby now. I'm relishing this role. But it helps everybody. But why weren't we doing this all along? Part 3 of the plan focuses on doula care. I love our doulas. Any doulas in the house? Doulas are pregnancy and childbirth experts who provide physical support, information, but also emotional support. I mean, let's face it, your hormones are out of whack. You are going through such stresses, and if this is not your first child and you have another one at home, my kids are about 1.5 years apart, but I was only 1 year younger than my brother. My mom had 6 kids. Yeah, this is stressful on families. We're really, really stressful. And to acknowledge that there are mental health challenges to all this is something that has not been really talked about for a long time, but it's real. Studies show that doula care is correlated to positive outcomes, reducing premature deliveries and the likelihood of postpartum depression. We've already taken steps to make sure this vital care is available, requiring Medicaid to cover doula services and signing a law making sure there's a statewide doula directory, because someone say, that sounds great, where are they? How do I find them? We're going to simplify it. You have enough to worry about. And our budget will make sure that you can have doula referrals without having to go to a doctor first. So we can make that a lot easier. So let's get that done. Part 4, I mentioned unnecessary C-sections. We know the risks. It's high risk sometimes. Fourth part of our plan will encourage doctors to avoid unnecessary C-sections as well. And we have a whole strategy around that. So our budget builds on our executive actions and provides also financial incentives for these doctors to reduce the number of unnecessary C-sections. All right, the 5th part of our plan, this is so important, addressing head-on maternal mental health. According to CDC data, 1 in 5 pregnancy-related deaths are due to mental health conditions. Every one of these was preventable. Every one of them was preventable. If someone had given these women, sometimes going through this alone, overwhelmed with the stress, their body's just so exhausted, and there's a baby that just won't stop crying all night long. All these were preventable if we had just given people a lifeline. That's why we're launching specialized trainings for counselors on the 988 Suicide and Crisis Lifeline, so they know what to say, so they're culturally competent, they understand also what's going on physically, mentally, and this will connect women in mental health distress with compassionate care and referrals to important sources. There's a program called Project Teach, which offers training to clinicians who don't have the knowledge. They may not have, probably didn't teach this in medical school. A long time ago, I guarantee they didn't. They need to now. That's my alert to medical schools. Start talking about this now, start teaching people, but also making sure there's supplemental training. I want to make sure that that's available to everyone. And finally, we're taking action to keep our babies safe so they have a safe place to sleep. More than 120 babies die every year in New York because of their cribs. They don't have a crib, they don't have a safe place to sleep, they're not protected. We're going to make sure that every child in the state of New York has portable cribs. We'll get them out to families in need, put a safe environment, instructions, let people know. You can't let the babies sleep in the laundry basket on the floor. You can't let them sleep in a drawer like I think my parents did when they lived in a trailer park with my brother. There wasn't a lot of space in this tiny trailer park. They didn't have any options. But we're going to make it better for people. We have to. Something as simple that others would take for granted. Of course you're going to have this. Some have these monitors. You wrap the baby in this swaddling blanket, and it monitors everything they do all night long. That's what my grandbaby is fortunate to have. Her parents can sleep better at night. If she skips one breath, the alarms go off. But that's how babies are being kept alive. But they're not inexpensive. There should not be a disparity between whether or not your baby's going to survive possible sudden infant death syndrome, survival, or death. It comes down to how much your family has to pay for this. I want to change that as well. The technology's there. Every baby, regardless of their parents' station in life or their economic situation, deserves to have that. We also want to make sure that it's available. As you can tell, this is personal to me. I've had a couple kids, but I also have a lot of friends and people that, you know, they're going through a lot. You know, their kids, other people's kids, you see it. And if I'm not able to address this head on, as the first mom to ever be elevated to the position of governor, then who will? So this is really important to me personally, but also I see that we have an opportunity here to change the trajectory for millions of New Yorkers and put them on a healthy path by making decisions like we are here today. A decision to say no more. No more. I don't want to be in that category of those who are so timid, afraid, not willing to challenge the status quo and do what's right for New Yorkers, even our newest New Yorkers, our babies. Every family, every mom deserves to feel the joy and excitement. If you're a black woman in the state of New York, getting pregnant should not be a death sentence for you. And that's the fear as I talk to young women. They are afraid. This should be a joyful time. Time to embrace this little person who loves you unconditionally. It should not result in the most horrific outcome, the loss of the mother, loss of the baby. It's just too painful. And I want to stop that. All families need our help. And that's what the state of New York is committed to do. Our capacity is limitless. We're only limited by our imagination, and my imagination is vast when it comes to this, because I've been there. I've been there, and I understand. So thank you, everyone. Thank you for joining us here today. I appreciate all of you for being part of this cause. Let me bring up one of our great champions, the one and only Rodneyce Bichotte Hermelin. Thank you very much, Rodneyce.
Good morning, everyone. I am Assembly Member and Majority Whip of the Assembly, Rodneyce Bichotte Hermelin, representing Brooklyn's 42nd Assembly District in Flatbush, but we are here in Brooklyn, joining Governor Kathy Hochul. Let's give it up to Brooklyn. It's so great to be here at the YMCA. I want to give a shout out to the YMCA here. Like many of you, I'm not just here as a working professional, I'm here as a mom. Because we all know that even when you're working, no matter what your role is, you are a caregiver. Your motherhood is job number one. So again, let's give a shout out to my baby Daniel, who's here, who's saying yay. To all the mothers, and a special thank to my doula, Allegra Wright, who's at work right now. I want to again give a warm welcome to all the mothers who are here, caregivers, maternal advocates, healthcare experts, our elected officials. I know we have Honorable Carolyn Maloney, Borough President Antonio Reynoso, who you'll hear from, Assembly Member Joanne Simon, and Assembly Member Bobby Carroll, my colleagues in the Assembly. We have Councilmember Mercedes Narcisse and Councilmember Jennifer Gutierrez, who's here as well. I just want to thank my colleagues in government for joining us today in this big effort. But today we join our first state woman mother governor, Kathy Hochul, to make motherhood safer for all. Almost exactly 5 months ago, I stood here in Brooklyn with our governor as she announced her maternal health agenda for the new year. Now, we just passed a historical $237 billion budget that meets the moment for motherhood. The budget brings real solutions and record-breaking funding as we're facing a maternal and infant health care crisis. Our governor is a steadfast advocate, an accomplished leader taking on the infant and maternal mortality crisis. It comes at a critical time with infant mortality rising nationwide for the first time in decades, while Black women keep dying and losing infants at a disproportionately alarming rate. I know that trauma firsthand as someone who lost her baby, Jonah, 7 years ago. a New York City hospital turned me away as my unborn child was protruding out of me, 3 centimeters dilation, with contractions and other medical complications. All they did was cite hospital policy and said that they could not help me nor save me. Their solution was to terminate. And then I was sent off to Wyckoff Heights Medical Center, thankfully, where culturally competent doctors did all they could do to save me and my son. But my late son, Jonah, passed after being delivered 22 and a half weeks. Now, I didn't sue. Instead, I introduced a bill that became law in the name of my late son, Jonah Bishop Cowan, to prevent hospitals from turning away expectant mothers suffering from preterm labor issues. And then I also decided to go to law school to help others in the courtroom. And in 2 weeks, I will be graduating from law school. And like Governor Kathy Hochul, who, when she was working for government in her earlier years, she was pregnant. I was pregnant. I went to school, I went to work, I even interned, pregnant, delivered a baby, and back to work. Like all of us, I don't want to keep repeating or hearing about grim statistics about our maternal health crisis. Our communities are always asking for action, and our governor keeps stepping up to the plate. Staying true to our promises, Governor Hochul has delivered 12 weeks of fully paid parental leave benefits to more than 80% of the state workforce. Our governor signed a law creating the state's first directory of doulas, making them available to all Medicare enrollees. Now we have become the first state in the nation to enact a standalone prenatal paid leave policy as part of the fiscal year 25th budget agreement. This is a bold step forward. Combined with our actions, makes a brighter future for all moms and aspiring mothers and our families. Just as importantly, new measures implemented as part of the budget will eliminate cost sharing for pregnancy-related benefits for those enrolled in the state's essential plan or other qualified health plans. The budget also includes vital provisions. It requires employers to provide time for nursing mothers to express milk. It increases access to care for postpartum depression, one of the leading causes of maternal health issue. Again, you heard the governor, addressing unnecessary C-sections and realizing that maternal mental health is a big issue, and making sure that our babies are sleeping safe. These are critical steps, allowing soon-to-be mothers before birth to take the right steps, take preventative measures, go to their appointments without losing pay, and to be able to access the high-quality maternal health care we all deserve. Once again, I applaud our governor for continuing critical advancements to the maternal morbidity agenda. We're taking action, so mothers aren't scared to go to the delivery room, so all New Yorkers are able to experience the wonders of childbirth and uplifting families to make raising a child easier and safer. I say thank you to all my colleagues, to all the advocates, as we keep working in the legislature with our governor to make motherhood safer and end health disparities for all. Thank you so much.
Please welcome Brooklyn Borough President Antonio Reynoso.
Good morning and welcome to Brooklyn, the greatest borough in the city of New York. But the great Christopher Wallace of the Notorious B.I.G. said, "Spread love is the Brooklyn way." So we don't care where you're from, even from Buffalo, we love you just as much. Hopefully my New York Jets do a little better this year, Governor Hochul. I just want to say, this type of work is deeply personal to me. As you will see, I'm the only man that's going to walk up on this stage. When my wife was having her baby or was pregnant, and we went to Woodhull Hospital to have our child, I knew very little about maternal health. I knew it wasn't great. but I just didn't think it would ever affect me. Then I met Ms. Helena Grant, who will speak after me, and she said, "You're a council member, right?" I said, "Yes, I am," at that point. And then she asked, "Do you know that your wife has a 9 times more likely chance to die during childbirth than her white counterpart?" She just told me that, and it shook me to my core. I just got so scared, so anxious, and I said, "What can we do about it?" She says, "Nothing. At this point, there's nothing you can do. For the next 9 months, you're going to do what we expect you to do, which is get your prenatal care and do everything you need to do, make sure you show up every single month. But this issue is not something that we can solve overnight. What happens is that elected officials, government, and everyone starts working on this issue at the margins. And we affect minimal change to the lives of black women during childbirth. That's what happens every single time. And I'm hoping that now that you know, you can do better. Since then, I became the strongest advocate for maternal health that I can possibly be. I decided that I had one promise I made during my campaign to run for borough president, only one promise, and it was that I would dedicate all my funding my first year to maternal health in Brooklyn to address this issue. And with that, we were able to give $45 million to our 3 public hospitals in Brooklyn to have state-of-the-art birthing centers. But even through that, I felt like we were swimming upstream. I felt like I was alone in this fight. And not enough people were talking about it. And I believe it is the grossest inequity that exists in our city. It's the grossest. No one else is 9 times more likely to do anything in this city on any other issue. Affordable housing, education. You will never see a disparity this broad that we see here on maternal health. And then comes along Governor Kathy Hochul. Every single year, I'm standing on a stage like this with more proposals, more issues, more legislation, more executive orders, more money, just nonstop addressing this issue of maternal health. Just doesn't stop every single time. And I can't tell you how grateful I am. And it's unfortunate that it took a mom to be governor for us to address those issues. It is unfortunate. Because we actually know how to save lives. We know everything. The data is there. We can eradicate this overnight if we just do what the data tells us, and we just don't. Women are choosing between going to work or prenatal care. That's unacceptable. We know that that makes a difference. Deal with it. Our governor has. Mental health issues. Women are dying after they have their babies because of postpartum depression and other issues. Before Governor Hochul, you don't have 3 months of Medicaid services for mental health issues. Now it's 1 year. Now she expanded that 4 times, from 3 months to a year. We should clap it up for that as well. My wife was a full-time student and had a full-time job and was pregnant and had a difficult time breastfeeding my first child. A difficult time. She was over it. She's like, I can't do it anymore. I can't sneak into any more bathrooms. I can't be allowed into any more teachers' rooms. It's just difficult for me to do. I don't want to do it anymore. Knowing that breast milk would be the best thing for our child. But she had to sacrifice it because society wouldn't allow for her to do it in a convenient way. It's unacceptable. Governor Kathy Hochul saw for that as well. This is the type of stuff that we need to start talking about and taking more seriously. And it doesn't, and we shouldn't have it be that only when women are in leadership positions that these things happen. Men have to get it too. So I leave you with all that. I also want to say Assemblymember Bishad Hermelin took her experience and turned it into action the same way I did, not to the same extent. I want to be very clear. But she took it into action and she decided to do something about it. Her position is not only to be an activist or to be an advocate. She is a legislator, and she got to work and legislated change in a meaningful way. She decided that she was also going to improve upon her ability to affect change by becoming a lawyer thereafter. That's the type of work we've got to continue to see. That type of leadership is what makes the difference. So thank you so much, Assemblymember, for your work. I leave you with all that. Thank you so much for being here in Brooklyn. And I want to say that please keep coming to Brooklyn, because Brooklyn is #1 when it comes to the rate of death in the city of New York. This is the most dangerous borough to have a baby in if you're a black woman, and it is unacceptable. In my time, within the 4 years that I've been the borough president. My goal is to make Brooklyn the safest place in New York City to have a baby if you're a black woman. And if I get the luxury of being the chance or the honor to be the borough president for 8 years, I want this to be the safest place in America for black women to have babies. And you're helping us do that. So thank you. Thank you so much for having me.
Please welcome President of New York Midwives, Helena Grant.
Greetings and salutations, everyone. I am absolutely delighted to share time and space with you all today as the president of New York Midwives, which is the state affiliate of the American College of Nurse Midwives, to acknowledge this robust maternal health package created by our one and only Governor Kathy Hochul. And I thank the governor for always acknowledging the crucial role midwives play in the healthcare infrastructure in New York State and providing comprehensive, culturally humble, evidence-based care to the women and birthing people of New York State. And as said many times here today, it's not lost on me that this, New York's first woman governor, would take the time and the energy, it takes a lot of energy to do this work, to move with both insight and foresight, and to think deeply about what women and birthing people of all races, all nationalities, all creeds, all cultures, and all income levels need to have holistic pregnancies, making New York the first state in the nation to create paid prenatal leave for pregnant moms. I mean, this is just absolutely huge. So as a midwife that has dedicated 27 years of her life to caring for women and birthing people, infants, and their families, mostly in communities that suffer from disparate conditions, social determinants of health, and chronic underinvestment, I'm over the moon with gratitude for what this governor has done, for what the state legislature has done, for what the city council has done, and for what our Brooklyn Borough president has done. It takes a village. We talk a lot about the village and community, about raising children, about making things safe for them, about creating a holistic environment around them. But we don't talk enough about the village it is within elected officials that also is a bi-directional communication that people need to utilize to create programs like this and programs that we are seeing throughout the state. There have been many times that I've spoken with patients over my 27-year midwifery career that had to miss appointments for work or were very late because they were just not allowed to leave their workplaces to get to appointments on time. Many struggle not just to balance appointments, but also have other responsibilities. We have a generation of moms who are not only childbearing, actively childbearing and taking care of children, but also have an older parent that they're taking care of as well. And so the struggle and the balance or the harmony that they need to try to create to do all these things should not ever be sacrificed. Many of the patients that could not make it to appointments time and time again would later end up in the hospital triage because intuitively, as a woman, they knew that something was wrong. So there would be a finality that would come and they would just show up. And many times they would then be diagnosed with a pregnancy complication that needed to be immediately addressed. So this investment by the governor of 20 hours of prenatal leave is going to absolutely decrease barriers to women and birthing people. It's going to aid in increasing healthy pregnancies. It's going to serve as a modality for birth equity, for reproductive justice, for promotion of continuity of care, and ultimately, it will aid in decreasing maternal mortality and morbidity and infant mortality and morbidity in New York State by essentially eliminating the choice that many women and birthing people are forced to contemplate when deciding whether or not to attend visits. This investment will make a difference all over New York State and will be especially vital in the ecosystem that is New York City, where women and birthing people have to at times use public transportation and consciously decide to travel outside of their community hospital or work area for their care. The decision to exercise choice to get to the clinician or groups of clinicians that they feel comfortable with will no longer need to be sacrificed. And notice I keep using the word sacrifice because what she has created is a modality to stop the sacrifice that many women have had to endure. Finally, and most importantly, pregnancy itself is a time of physiological and psychological stress. This investment by the governor will also significantly decrease the stress hormones of pregnancy and cortisol, which are clinically shown to increase pregnancy complications, prematurity, low birth weight, and wreak havoc on the baby's stress management system. So New York Midwives is proud to partner with Governor Hochul to ensure that pregnancy and childbirth in New York State is an experience for all women and birthing people that is both safe, satisfying, and sacred. Thank you all.
Please welcome Dr. Wendy Wilcox, Chief Women's Health Services Officer, New York City Health and Hospitals.
Good morning, everyone. Still morning? I think so. If it's not, it's okay. You can forgive me. As you heard, my name is Dr. Wendy Wilcox, and I'm proud to be the Chief Women's Health Officer for New York City Health and Hospitals. I am also an obstetrician gynecologist, as I have been for almost 30 years. I am also a member of the American College of Obstetricians and Gynecologists. I am so honored to be here today to celebrate Governor Hochul's and the legislature's commitment to improving maternal and infant health outcomes and their effort to enhance access to prenatal care services in New York with the expanded leave policies passed within the budget. Prenatal care services, as you heard throughout this entire morning, are extremely important for the health and well-being of our patients and provide a critical opportunity to address pre-existing health conditions, treat health issues that may arise during the pregnancy, create space for patients and providers to communicate and address all needs and questions. As New York State continues to focus on prioritizing maternal health outcomes and reducing maternal mortality and health disparities, this initiative is crucial. Guaranteeing leave, which can be used for prenatal care, will help bridge the gap that many patients experience in being part of the workforce and prioritizing their health and their pregnancy. As you've heard, we have to ensure that pregnant women will be able to take off time from work to attend crucially important care during their pregnancies. And what you may not realize is it's not just visits with their OBGYN or their midwives. There can be additional visits during the pregnancy as the need arises. We have high-risk doctors. Those visits may be added on top of their general OBGYN or midwifery visits. We have visits with mental health providers that may need to be attended, and there may be other medical specialists who they need to attend their visits. Cardiac disease is also a #1 cause of maternal mortality and severe maternal morbidity. And one of our efforts at New York City Health and Hospitals is setting up a cardio-obstetrics practice to deal with cardiac issues that arise during pregnancy. I am also a mom. And when I was pregnant with my first child, who's now 25, thank the Lord, I also had gestational diabetes. Now, this happened to be during my residency, and as you heard from I was going to call you the Honorable Helena Grant. I usually call her Queen Helena. Stress is a huge player in poor pregnancy outcomes. As an OBGYN resident, I'm sure you can imagine the stress I was under. and having to work back in those days without the resident protections that we have now, sometimes every other night or every third night. And it was right here in Brooklyn at Long Island College Hospital, which unfortunately no longer exists. But I made my visits, and oftentimes I would go after, like Governor Hochul said, after being up all night, but I would still make my visits. But then I started a job as a new attending and had not really accumulated any time. And I had to continue seeking care. Now, thankfully, my employer allowed me to do that, but really that can illustrate for women who are not able to do that, how they sometimes have to choose between putting food in the mouths of themselves and their families, keeping a roof over their heads, or attending prenatal visits. And so that is why this protection for prenatal care and the provision for coverage during prenatal care visits is so incredibly important. So, prioritizing working over feeding families or keeping a roof over your heads and not accessing prenatal care is certainly not what we want in the state of New York, and it no longer has to be a choice. I am extremely proud that Governor Hochul and the legislature put forth this initiative for paid parental leave for pregnant moms in their budget and understood the value that this proposal holds and included it in the final package. And being the last speaker, it is my extreme privilege to thank each and every one of you for being here today to hear this important message. Thank you.
This concludes